My passion project topic is pediatric nursing. What is a pediatric nurse? Pediatric nurses, also known as peds, work with the children of many ages in a variety of settings. This could be infants all the way up to 21 years old, and sometimes older in special circumstances. Some of the settings could possibly be hospitals, doctors' offices, home care, schools, public health centers, juvenile detention centers, and hospital-based intensive care units. What do they do? Peds perform patient vital signs including heart rate, blood pressure, and oxygen levels. They talk to parents and record patient history. They perform EKGs and other tests. They also obtain accurate patient information needed for diagnosis and treatment. They explain tests, procedures, lab results, and care instructions to patients and their families. Educate patients about invasive and non-invasive procedures. Work with other medical staff and non-medical personnel. Communicate with other medical service providers. Processes patient paperwork. Arrange for hospital admissions, clean and stock exam rooms, and clean and sterilize equipment. How long does it take to become a pediatric nurse? It generally takes about 4 years, but many students seem to be stretching them to about 5. Although it can be a difficult and busy schedule, it can be completed in the 4-year time period. It also depends on the degree you plan to complete, whether it be an associate's, master's, or bachelor's degree. Why it's my passion. I've always been interested in the medical field. As a child, I always said I wanted to grow up and become a doctor. My mom influenced me a lot as well. She worked at Dr. Bobby J. Brooks' office here in Campbellsville for about 10 years, and she now works for UVO Pediatrics here in Campbellsville. She's been there for about 3 or 4 years total now. Also, I love children. Being around them never fails to put a smile on my face. Most of all, I love being able to help people. So being able to help sick children get well, to me, is the perfect job. You have to be willing to get up every morning ready for work, and it needs to be a job that you won't get tired of. And of course, this is something I could never get tired of doing. Being a pediatrician or any kind of nurse practitioner is also has a very good job outlook, because of course there's always going to be demand for nurses and doctors and any type of job in the medical field. So that's good. Where I plan on going. When I graduate high school, I plan on going to WKU to complete my study as a pediatric nurse. Okay, I have a couple of videos to show.
Great video discovered and brought to you by Nursing Shepherd. For more information, please visit www.nursingcareertips.com. Thanks for watching and enjoy the video.
To care for the sickest of the sick children from all over the world, the nurses and other caregivers at Children's Hospital Los Angeles have to be the best of the best. But for new hires, especially new nurses, starting a career in such a challenging environment can be filled with both excitement and trepidation.
My emotions the first day on the unit here at Children's Hospital Los Angeles were, I was a little fearful, I was anxious, I was excited.
Even the best nursing schools in the country can't train new nurses to handle the complex pediatric cases at a place like Children's Hospital Los Angeles. So, the hospital started their own nurse training program, modeled on the rigorous residencies of its doctors.
What you learn in nursing school is totally different from what you're doing in real life. Any pain? Nowhere? Nursing school is books, but once you're really in the hospital setting, can't turn in books and say, this is what I'm going to do.
The goal is to take the best and brightest nurses fresh out of school and give them the safest on-the-job training anywhere in the world.
Day one, I was very afraid of the patients for some reason. They were just so intense looking, tubes coming out of everywhere, the monitors going off, the medications they were on I've never heard of before. It's like, these are not the basics that I'm used to. What's going on?
A nursing boot camp of sorts, the program is incredibly demanding. But then again, so is a career on the front line of pediatric care.
I've had days where I definitely go home crying, but I think you realize the difference that you can make every single day. And you come back the next day ready with a smile on your face and ready to do it all over again.
The Versant RN residency began at Children's Hospital Los Angeles in 1999 as the RN residency in pediatrics. 22 weeks long, it's an intense program of classes and hands-on training that has since become the model for pediatric nurse training programs across the country.
The kind of nurse that really will excel at Children's Hospital Los Angeles is somebody who's up for challenge, who really can handle the pressure, but somebody who's also really compassionate.
Whether it's the Pediatric Intensive Care Unit, the Children's Center for Cancer and Blood Diseases, or the Cardiothoracic Intensive Care Unit, these nurses learn from day one that children's lives depend on them.
Okay, I have some stuff that I got from my mom that she brings home all the time. Of course, here are some Band-Aids. And this is a tape measure that she uses to measure the babies' heads, newborn babies. And of course, here are some stickers that she would give to kids after they leave a room, if they're upset, or whether they did good or whatever. And there's this. She uses this to stick her fingers to get blood out for tests or whatever else she uses it for. I also have another video.
Hi, my name is Katie Brosnan. I'm a registered nurse here in Austin, Texas. And the question is, what is a pediatric nurse? A pediatric nurse is the same as any other nurse, but they're dealing primarily with the pediatric population. This is anywhere from babies to 17 or 18-year-old children. They have hospitals that specialize in this so that you're not kind of putting those two demographics together. So you've got children's hospitals in mostly every major city. They have an ER, OR, they have NICU or oncology units that are specialized just for children. And so the cool thing about this is that everything's tapered for them. So you've got different kinds of blood sample vials, you've got different sized gowns, different sized beds. It's a more fun environment. There's probably a whole lot more laughter in those settings as well. So basically, a pediatric nurse is doing the same thing as a nurse that's working with adults, but it's really geared towards children.
And that is my passion project.